Join me in the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Thank you so much. All right, let's move on to item number 2.1. Approve the minutes of the November 5th, 2024 Community Health Board meetings. Are there
So
any?
moved.
We have a motion.
Second.
We have a second. Any discussion? None, see none. All in favor? Aye.
Aye.
All right, minutes are approved. Now, item 3.1, we're going to receive a Community Health Board report from the Community Health Services Administrator, Public Health Staff, and Scott County Medical Director. Good morning. Uh-oh, we don't have any, do we have any? There we go.
Sound.
There we
How's
go.
that? Better?
Green. There you go.
I'll say that again. Good morning, Commissioner Beer and Commissioners.
Good morning.
Good morning. Today, we're going to receive, hopefully, a report from the Community Health Board. And as a reminder, that's not working.
We're getting used to our new AV equipment.
How do you make it display? While we're doing that, just as a reminder, we are required, mandated, thank you very much, to meet as a community health board twice per year. So this does meet our first mandate of the year, so we can check that off the box. And some of our other mandates here are we are to focus on 6 areas of public health responsibility, including assuring a local public health infrastructure, promoting healthy communities and healthy behaviors, addressing infectious disease and other environmental health hazards, respond to public health emergencies, and also provide that assurance role for health services that are not available in our county. We are also required to conduct a community health assessment, which you'll hear more about in a little bit. So we are going to do some program updates for you today and highlight just a few things from our most recent report to the community, which you do have hard copy in front of you. We'll just show you a few highlights from there. We'll talk about what's up for 2025, provide that update for the community health assessment and where we're at currently. We'll also hear a little bit about some of our successes from our WIC program and then talk about infectious disease. So for the report to the community, we're going to highlight some family health home visiting data, some follow-along data, and then we'll do just a little bit on what we are have been doing for health promotion in 3 program areas. In family home visiting, we have here some 5-year trends. And I have, just to show a few changes over the past 5 years. As you can see, most of our family home visiting prior to 2022 was focused on that MESH and MOF model, traditional home visiting. And then in 2022, we've added parents as teachers and a couple staff that are focusing on that, and it has become very popular. And it is also that continuation of services. So the traditional intensive home visiting focuses on that 0 to 2, and then that parents as teachers model, we can extend our impact on kids by going 3 to 5 right until they get into kindergarten. And we added that because we noticed some kids were kind of backsliding after our initial work with them, and this helps that continuity. So in 2024, we completed 2,233 family home visits. 36% now were parents as teachers, 41% was our MESH, maternal early childhood sustained home visiting, and 23% is that traditional home visiting. Traditional home visiting is where it is an evidence-based model, but it's more of a one-time or short-term visits, getting people starting off right. It really is based on family needs. And traditional visits can be anywhere from 1 to 2 visits, just periodically over 1 to 2 years, versus the regular maternal, the MESH program, or the Parents as Teachers program. So a little bit more intensive there. Some of our successes, we do evaluation regularly for our program, and we do parent feedback and surveys. 85% of families in a home visiting program said that they read, sing, sing songs or tell stories to their children daily. And we know that this is very critically important for language development, for getting ready for school. That is very helpful for brain development. 80% of children in family home visiting programs were screened for a developmental concern on time. Some of them didn't need it because they may have received services elsewhere, but through our program, many were covered. And then 100% of parents reported that they feel that they are better able to cope with life and understand their baby's child development. Some other parent satisfaction reports. This is specifically from the Parents as Teachers model. Parents who strongly agree. And the light blue is from 2022, 2023, and the dark blue is 2023, 2024. My parent educator encourages me to read books to my child. So as you can see, 67% reported that happened in 2022, 23, and we're up to 88% in 2023, 24. As you can see, we have made improvements. We're getting better. It was a new program in 2022-23. I believe we'll just continue to get better as we work, as we get more trained in the program. And some of the other work that they do, and the parents reported, the educator helped me find useful resources. The parent educator shares my child's screening results in a way that makes sense. So those last three, the trust, the finding useful resources, the screening results, those were all reported at 100%. So we're getting there. We still have a ways to go. Follow-along program data. We had 107 new follow-along enrollees in 2024, which brings our total of follow-along clients to 400. Out of those 400, 74 referrals were made, and that's for something that they may have been shown in the follow-along screening tool, the questionnaire, to maybe be falling behind, and they are connected to resources. So that could be speech, it could be OT, PT, etc. For enrollment and engagement, I've got a 5-year trend here. You can see our total enrolled versus new enrollees each year, and then number of referrals that have been made. It's interesting to see, that the numbers have gone down, but that is also because we have a declining birth rate in Scott County. But we've pretty much maintained level the number of referrals that have been made. So we are still finding the right kids. We just have less kids. This is a little bit of SHIP information, the number of SHIP grants awarded. Last year we gave 33 awards. The dollars still about remain the same. Each year we give out to the community about 75, somewhere between 75 and 85,000 last year. It used to be about 100,000. The SHIP money over the last 5 years has not increased. Salaries have, so we have a little bit less to give away. But over the last same period, we have been very successful in helping the community leverage other funding. So in 2024, we had 714,000, almost 715,000 in leveraged SHIP dollars, 973,000. This is through partnering with community partners to help them acquire grants. It's through donated service. It's through in-kind services that community partners are leveraging on their own. So really, there's a lot of capacity building that happens in SHIP. In our drug-free communities area, just a few highlights here. This is the Take It to the Box drug disposal kits. And as you can see, each year we keep track of the number of pounds of drugs that have been dropped off in the boxes. At the same time, we introduced in 2023 some doTERRA bags. So these are bags that dentists, pharmacists, physicians, we have them here at the office. This is so people can do their drug disposal at home. And they're just little kits. You throw your medication in, you mix it with a little bit of water, it deactivates the medication. So we don't want people flushing their drugs down the toilet because that's bad for the environment. So we have another way of them disposing of their drugs. In 2023, we gave out almost 2,000 of those kits. In 2024, about about 1,067. We are also in the process of securing new Take It to the Box boxes. As you can see, that's one of the new ones there. It's a mock-up of the design that's coming. Some of the police departments pointed out some vulnerabilities with our current boxes, aside from that they're getting old, that people were able to reach their hand in there and extract disposed medication and drugs. So we are updating our boxes. We also have our logos. Actually, we partnered with Choose Not to Use on here to pay for these boxes and use some other funding that we had, and it is very branded. These are very safe boxes, and partnered with the police departments, and they're all getting the same box. So it's going to be branded all across the county.
So, Mr. Chair, so for people watching, these are at all the police departments?
Most of the police departments.
Okay.
They're not at the city of Shakopee because we have one in county.
And also, it's not maybe environment is the only issue. It's if you're flushing drugs down the toilet, isn't it showing up in drinking water tests?
I would have to check that out unless Dr. Wilcox knows that answer.
I think it does occur on occasion.
It
Yeah,
does.
I feel like I've seen reports where different pharmaceuticals are showing up on drinking water tests, so take it to the box.
Yeah. Thank you. And I can make sure I can verify that for you via email. Some naloxone incidences. We have been really focusing on getting naloxone out into the community for people that need it. In 2023, we became a naloxone access point over at Scott County Public Health. People can come and pick up naloxone. In addition, in 2024, we added a 24-hour access naloxone box that has naloxone, fentanyl test strips, as well as Datera bags. And as you can see, our distribution really increased in 2024. The other good news is the naloxone incidences in Scott County. There's a 5-year trend there. They have been going down. We get this information directly from EMS. The number of doses they use, as well as the number of naloxone incidences. And you'll notice, or OD incidences where they're using naloxone. You'll notice the number of doses is a little bit higher than the number of incidences, and that is because sometimes when they arrive on scene, they need more than one dose, particularly with some of the newer drugs that are out there. Just a little bit of OD data. In 2023, we had 20. In 2024, between January and August, this is information we get from the coroner. It's not finalized yet, but we had 9 from January to August. And this report is based on location of death, not just Scott County residents, so it's anybody that has OD'd in Scott County. The same with the naloxone incidences. That has occurred in Scott County, not just Scott County residences.
Mr. Chair, Lisa, do we know how many Scott County residents of those, or do we not get that information?
Commissioner Brecky, I don't have that information written down, but I can get that information for you.
Thank you. It'd just be interesting to see if it's very different.
I have made a note, and I will get back to you on that.
Thank you.
This data you see here is the Community Readiness to Change score. This is very interesting data. The community readiness model reflects how willing is the community to admit that it's a problem and to address that problem. When I first started here 10 years ago, I just had my 10-year anniversary. When I first started here, nobody really talked about substance abuse issues in our county, and from the Minnesota Student Survey and other data that we had, we knew that this was an issue. We had some of the highest rates at that time for youth smoking marijuana and drinking. At that time, we did a Community Readiness to Change survey, and we scored on the survey a 1.5. That's denial and resistance to change. That's what that means. Within just 3 years, we moved from 1.5 to a 2.8, which is very close to somewhere between awareness and pre-planning. People are ready to start admitting that there might be an issue here and are willing to look at it. And our most recent one last year, we were at a 4.6. So that's like we're initiating change here. We're ready to change, and we have implemented some efforts. It also means that leadership is actively supporting and continuing on improving current efforts and developing new efforts. and we are concerned about this. We want to do something. So we're pretty happy with this data, and we do hope that it continues to go up. We will repeat, we were very deliberate in 2024 to do the survey. We're going to check in a couple more years to see where we're at, and hopefully we won't have any backslide due to the recent legislation that legalized marijuana and some possible legislation that might be legalizing mushrooms as well. So hopefully we'll continue to make positive change in this area. Just some data related to COVID. We still have COVID. We're still distributing COVID tests. In 2024, we did see an increase over 2023 in the demand for free COVID tests. Even though they are available at pharmacies, people are still needing them for free. We distributed twice as many in 2024 that we did in 2023. So still an issue out there. So what are we going to look for in 2025? We are going to continue our amazing services. That's the first thing. We are going to really focus on continuing to help children get caught up on vaccines, and we'll talk a little bit about some vaccination and disease trends. We are in process of expanding our WIC services, so we're doing some expansion beyond our four walls. We have WIC services at the FRC in Shakopee right now, and we have expanded to the Savage Library, and we will be expanding shortly into the Jordan Library. So really getting our services out there, making it more convenient. Families are loving not having to drive all the way to Savage, or from Savage to Shakopee. It saves them a lot of time, particularly if they're coming with their kids, and that has been very, very successful. We are going to be wrapping up our community health assessment soon, and we will start to begin our community health improvement plan. Both of those, again, are mandated services. We're required to do a full community health assessment every 5 years and develop and implement a community health plan to address issues that are identified. And we are, I am particularly excited about getting some early childhood screening data. Shakopee made us aware of a new screening tool that all of our districts are going to be using. And the marker that we're going to be taking is how are the kids reading on their first reading screen at entrance to kindergarten. So we're going to be doing some analysis on when did they get screened and were they ready to read, or to enter kindergarten, pardon me, not reading. So, and then we'll take that, I kind of consider that an intermittent score, and then we'll use that data to take a look at, are they reading at 3rd grade, and see, I lost my screen, and see what happens there. My screen went black. Oh, it's back. Just trying to throw me off my game today. Anyway, so we are really excited. We are connecting with the other districts as well to do the exact same analysis in those school districts. So going beyond Shakopee, and because they're all using the same screening tool now, and hopefully we'll see some trends. Moving on to the community health update, we've talked a little bit about this in previous meetings, and we have moved from the data collection, the quantitative data, to qualitative data. So we are out in the community, we have been out in the community conducting focus groups just to kind of get the story behind the data and hear from people. We conducted 8 focus groups totaling 44 participants, focusing on some specific populations including youth, rural older adults, Spanish-speaking and Hispanic Latino, and then also Somali women. The goal was to hear directly from community members of how our identified priorities resonated with them and gather some ideas for community-centered, culturally responsive solutions. So we conducted these between February and March of 2025, as well as we partnered during this time, with community organizations to really meet people where they were at. The focus groups were about 90 minutes to 2 hours, and they focused on physical, mental, emotional well-being, and really provided some valuable insight for us on challenges, barriers, and solutions that they were willing to share. Here's a little bit on the barriers to accessing services and being healthy in Scott County. I'll just point a few out. Many mentioned the high cost and lack of resources for low-income groups. difficulty navigating the health services, lack of awareness of existing services, as well as lack of culturally specific education outreach and resources for those. Many mentioned, and here's a quote, "Transportation out here is really difficult. We've been helping to manage the care for an elderly neighbor, trying to get her rides to any place. If you're not able to do it, it's nearly impossible." And that came from a rural older adult participant. Seniors in Elko and Hispanic residents in Shakopee shared that they're often they're having to seek services outside of Scott County. And I believe I've shared this before, to get to the closest FQHC, which is a federally qualified healthcare entity, it's almost a 3-hour bus ride because you have to make so many connections, and that's very hard for families, especially if you're toting along 3 kids. Several participants described feeling disconnected or unseen in their attempt to access services. Participants shared they were very excited to share opportunities and offer solutions that would work for them. What came up frequently was low or no-cost services, especially for those that are uninsured or underinsured. Designing resources and services to be accessible to populations they are intended for. So that means culturally appropriate, specific age groups, and immigration status. Some of the rural older adults one participant said that, or asked if we could offer a full day in the fall to get COVID shots, because it appears that they are like at their place of residence, because it appears that they are still having difficulty accessing those. Participants emphasized the value of intentional outreach, especially in underserved areas. They highlighted the power of community connection and having services that are designed with specific populations in mind. And they gave us praise for successful examples like COVID vaccine clinics, community resource fairs, and collaborations with local organizations and businesses that were already doing this work. The community survey results, and I'm hopefully going to be able to do this. We are currently working on a dashboard. So our data, we're required to make our data forward-facing and to put it out there. Last time we did this, we had a 400 and something page book, a little bit heavy to carry around, and people aren't going to print that. So we have created an electronic dashboard. And I think I have to hit escape. And the link is in there for you, but this is what it looks like. We're using Power BI. It's not yet available to the public, but is currently built. As you can see, all of our data will be on here. We have the topics across the bottom: overall health, mental health, access to healthcare, food access. And these are the results from our community health assessment with description of who we surveyed, et cetera, how many people. I'm just going to click on one here. So food access. So as you can see, these are the questions that we asked in the survey. All the answers are here. It's very interactive. The first screen that you get is the overall answers, and then you can specifically look at, what was the difference between males and females by age group, by race, ethnicity. So very interactive data. There's a ton of data on here. I encourage you to take a look at that and connect with me if you have any questions. This hopefully will go live as soon as we figure out how to do that. And we're working with IT right now, but we're pretty excited. This is the first time that we are going to have this data in this format in one place. And I think I have to go back to here. And press a button. What button was that? Control. Sorry. Perfect. Thank you. Lastly, I want to talk about our AmeriCorps program. This is the value of AmeriCorps members that we've had over the past 3 years. Since 2022, we have received almost 7,000 hours of basically free AmeriCorps services. And we could not have conducted such a robust community health assessment without our AmeriCorps. They were out there, they were collecting data. I have some of those folks in here. in our audience. Several of them were helpful in collecting that data. We actually, our first AmeriCorps that we had, Emily, she's here, we actually hired her as a staff person and continued her work. She's our Drug Free Communities person now. Over the past 3 years, we've had the value of their service and time has provided $251,000 worth of labor. We were slated to receive 4 AmeriCorps in July, 4 full-time people. Unfortunately, some cuts at the federal level have completely gutted the Public Health AmeriCorps program, so we no longer have that access to those 4. We are very saddened by that. We hope it will come back in the future because we had many projects lined up for those. I just completed an application yesterday because we were an early adapter and a good partner with AmeriCorps. They're letting us access a different program, the Recovery Corps program. So we're hoping to get 1 full-time person to work on some of our substance use and prevention work and our opioid work as well. So hopefully in July. I am going to now turn it over to Jody Liris, who will do an update on WIC. You just have to press that.
Good morning. Thanks for having me here. So I'm going to talk a little bit about WIC. If you're not real familiar with WIC, WIC is a program that provides food packages to women, infants, and children. Some people think of it as the formula program, but it really is so much more than formula. In fact, we'd rather not give out formula. We'd much rather give out breastfeeding support. But that is WIC, and WIC came to the county back in January of 2022. So we're working kind of from that point onward. Let's see. So our unduplicated WIC population has increased somewhat. We had a pretty big jump that first year after they came, and then just a little bit smaller jump last year. But as Lisa said, we're really working on expanding our services out to the communities rather than them having to come to the government center. So Savage Library, I'm working on the Jordan Library, the FRC, actually it's the FRC at the Savage Library and the FRC here in Shakopee that we've expanded to. I probably will get ahead of myself. But some of the successes that we've had with WIC since it's come. So about 133 people were referred from WIC to the early childhood screening programs. Our peer breastfeeding support group had 184 participants in it, so that's been a great increase. Total WIC benefits that have been provided is over $1 million, $1.3 million. So I like to think about that as $1.3 million worth of food has gotten to our families to support their growth and development. And $1.3 million has gone back into the economy because of WIC. This is talking a little bit about the expansion. We've kind of covered that. So we're really hoping that we'll be moving into the Jordan Library next. As you know, we also provide services in Carver County, and we're looking at expanding to the Waconia Library in Carver. One of the things that is kind of the reason that 50 years ago someone created the WIC program was because of iron deficiency anemia or low blood hemoglobin. Hemoglobin is the oxygen carrying part of your blood. Without an adequate hemoglobin, your body's not getting enough oxygen, so your brain is not getting enough oxygen. So fetal development is impacted when mom's iron is low. Also, a mom gives a baby an iron store for their early months after they're born. And if mom's hemoglobins are low, they don't have enough to give to the baby for that store. So iron levels are really important, and they can really impact development of a baby and a child. So WIC at specific intervals, we'll check hemoglobins, both in pregnant women and then children. In 2024, our WIC program completed 2,181 hemoglobin checks. And of those, we found 393 whose hemoglobins were low. So we have a specific logarithm that we follow, that if it's, this to this, then we provide nutritional education, we provide handouts that talk about iron-rich foods. If it's significantly low, then we make a referral specifically to the physician and provider for that person. One of the great things that came in the food packages in the past few years was a cash benefit for fresh and frozen vegetables. And of course, we know that the dark leafy green vegetables have high iron. So people in the WIC program are able to buy those fresh leafy green vegetables to increase their iron. And who knew that Multomeal is a high source of iron? That also is one of the foods that's provided in the WIC packages. So we really look at being able to help people to increase their iron, their hemoglobin through the foods that they're eating. One of the other programs.
Mr. Chair?
Yep.
And this is great. Once babies or mothers are identified and they're referred and the education happens, how often is there a recheck or a follow-up on those folks?
Sure. So we will recheck them depending on what it is. We'll recheck them the next time they come in. So usually, so WIC has the discretion to say, come back in a month and let's
Right.
recheck this.
Perfect.
So it really is whenever the nutrition educator feels that they need to come back in and have it checked.
Okay, great, thank you.
Yep. One of the new programs that we're doing this year is in collaboration with the SNAP program, and we've identified a farmer that will provide a package, a box of vegetables throughout the summer months. And they take $10 from their SNAP benefit, and then
It's a $30 box of produce, and they pay $10 from a SNAP card to get it from the farm.
yes, okay. So that's going to be another really important way of being able to increase not only hemoglobin, but really overall nutritional value with fresh fruits and vegetables. We recently completed WIC program evaluation by the Department of Health. We had someone come out from MDH, met with our staff. They observed appointments, and some of their findings were that we really have a solid WIC program. And I give the credit to the three people sitting there, but the rest of the staff also. They really are a stellar WIC staff. They are able to build trusting relationships with our participants. They're really strong in their participant-centered services, so that we're really looking at what are the needs of the client? What is the client wanting out of this program? And then we weave into that the stuff that we know that they need also. There's a very strong focus on the participant. Staff are looking at the participant, talking with the participant, and not in front of the computer typing in their data that they have to gather. Their documentation is excellent. The program is innovative and forward-thinking, looking at expanding and different places that we can meet with families. Great collaboration with other county programs and community programs alike. All right. Is there any questions about WIC?
Mr. Chair and Lisa, some of these are for you. I should have been asking all along, but I didn't. But before we go to Dr. Wilcox, follow along program. When we refer folks out for the follow along program, do we do a follow up after they're referred, or do we know how many take advantage of that referral?
We could get that data for you.
Okay, and then I guess maybe I was just looking for your thoughts on federal funding and state funding. What programs are most at risk right now? What should we be most concerned about? Thank you.
Commissioner Brecky, thank you for the question. Well, we're not really sure what's going to happen yet. I think what I'm watching very carefully, what Public Health is watching, is what's happening with the CDC. We are particularly concerned about cuts to vaccinations, infectious disease area. I think we're pretty safe on emergency preparedness. It has been called out as a priority, as well as public health infrastructure. But as we lose funding for uninsured and underinsured vaccinations, which has been on a target, and as we lose some of that infrastructure, we're going to see in just a moment an infectious disease update. Almost the direct impact is that we see more infectious disease. And if we eradicate that safety net, we are going to just be continuing to go in the wrong direction. From a state level, honestly, I think public health, from what I last saw, but we know it changes every day, I think public health is pretty safe. We are a little concerned, though, the impact on the state or the federal budget to the state, particularly if there's cuts in Medicaid, if there's cuts in SNAP benefits. If there's cuts in SNAP benefits, every time there have had cuts, we've seen a dramatic increase in people needing WIC. So even if WIC isn't cut, if other cuts are made, it will definitely impact our services. We know we're poised. I would have to say we may be poised for another pandemic if they keep eroding some of our safety nets, particularly through the CDC.
Thank you.
I'm sorry that was so doom and gloom.
No, just thought we should get the,
Yeah, I do
thought we should
appreciate
get the reality out there where we're at right now.
Thank you, and I think Dr. Wilcox may cover some of that in his update as well.
Thank you.
Well, good morning, Commissioners.
Good morning.
Good to be on board here. This was a great segue for what I'm going to be chatting with you about at this point. My focus for the rest of our time here, which I know is short and you have a tight agenda, is on infectious disease and management of that. And I'm going to be focusing in particular on the young and the need to vaccinate the young with usual vaccinations that we used to provide on an ongoing basis to prevent what we describe as exposure to additional diseases throughout one's lifespan. So I'm going to be focusing today on vaccinations related to usual childhood diseases, and I'll cover those in just a moment. Some good news is, up to this point, vaccinations have actually had an uptick in the year 2024. And you can see in our graphic here that this uptick is a positive one. And you can see it excludes, however, COVID-19 and the influenza vaccination program. Now, the negative on this is, unfortunately, we still in our young people have not achieved a level of proper vaccination to prevent spread of these usual childhood diseases. And what you can see here in our graphic, the hope is with the vaccinations that we provide to the young, that they will achieve within that group a 96% level of vaccination updating. We're well below that for all of the vaccines that we are listing here. Tdap, polio, MMR, I'll be focusing on that one. That's the measles vaccine. Hepatitis B, varicella, which is that we administer for chickenpox. And you can see in our graphic, we like to achieve a 95% level of vaccination to the young people within that early time frame. We're well below that. And the concern is if we stay below that, these infectious diseases will continue to be transmitted to individuals around who have not been properly vaccinated against them. As we look at the current measles outbreak, what we see listed here in our graphic is pretty outstanding. In 2024, there were 16 outbreaks of measles in our country, representing 285 cases. And at that time, Minnesota had 70 such cases. As of May 1st of this year, there have been 12 measles outbreaks in the U.S. in 30 states, with 935 cases for the year. As of May 1st, Minnesota has had 2 cases of measles outbreak. Now, I would suggest to you the most recent data, which I just obtained from the CDC as of May 15th, would indicate that at the present time in our country, there have been 1,024 cases of measles documented. These have been documented in 31 different venues and in 30 states within the United States. Of those that have ended up getting this measles, red measles issue, 96% have not been vaccinated against that virus. And those are the ones then that end up with significant disability and to some degree death related to this. As I've suggested to you, there are 30 states now who are dealing with this. And in the state of Minnesota now, we've had, since this document this listing was listed, we've now had 15 cases of measles within Minnesota at this point. Those frequently end up with hospitalizations. The young are very vulnerable. 50% of these individuals end up needing to, were admitted because of significant related issues related to encephalitis and pneumonia, which is a secondary effect of the red measles type of problem. So as you can see, unfortunately, the red measles issue continues to be a major problem. And although our vaccination numbers are on the increase, we have not achieved a 96% level of vaccination yet that'll prevent additional spread of the red measles virus, which is rubeola. So how do we deal with this stuff? How is our public health service dealing with this? Well, you can see from this graphic, we are approaching it in several different ways. We're sending reminder texts to parents of children in need of vaccinations. We're continuing to offer vaccination clinics to help kids get caught up. We're very aggressive about that. We do have a revised vaccine protocol, and I will not cover that with you today, but you can certainly touch base with us and we can review that if you have questions about that. We are talking to our active clients about the need for vaccination updates. We're educating about measles and vaccinations that are appropriate. And we're doing this by posters, by mail, and Scott County Facebook. Social media, we're utilizing that. And then there are upcoming social media campaigns related to vaccinations and immunizations as well. So with that, I know you have a tight time frame. We got not a lot of time for questions, but do you have any questions at all about infectious disease and in particular measles, red measles at this point, and the vaccinations needed to counteract this problem? Any questions?
I've been thinking a lot of different things here, so I hope I didn't miss you on this one point I wanted to ask. You know, when I was growing up as a kid, I had to get all these vaccinations, and my understanding is that was required. You had to have this bank of vaccinations to attend school. If you didn't, you couldn't.
Yeah.
Is that true today?
Parents have the option to opt out, which is problematic. They're given the opportunity to not vaccinate their children if they have some sort of a reason why they may not want to do that. And that becomes somewhat problematic because it does leave the vulnerable exposed to the measles virus, which can be spread very quickly within a school system. Measles in particular is a highly infectious virus. And once you get it, you got to be isolated for extended periods of time until the issue has fully resolved. All of these childhood diseases that I have mentioned here that demand vaccinations early on in a child's life can lead to an infectious disease problem that is truly problematic for the vulnerable. So we're talking about the young, we're talking about the elderly, we're talking about those who are immune compromised, and in particular, we're talking about pregnant women who are not properly vaccinated prior to conception.
Okay. I just have one more thing, and this is going to come from way out of left field.
Love it.
I'll make it quick. There was an article in the paper recently about a developer in Burnsville that wanted to put pickleball courts over a landfill and also parking lot.
Yeah.
And the concern was that this is where the water supply, close to the water supply for Savage, it's near the quarry mine, Kramer mine, where they get about 80%, I think, of the water Savage. And the question is, when they stop mining, will that groundwater rise and contaminate the water supply for Savage with the unlined dump that's there that they want to put this stuff on. So I'm just raising it. I would like our environmental services and community health to monitor this issue. So I just felt it was the easiest way to bring it to attention.
It's a valid point. We can check that out. Okay? Happy to do that. Any other questions about infectious disease and in particular the red measles outbreak that we're contending with right now in our country?
Mr. Chair, now that you have the gavel, Dr. Wilcox, I just want to say thank you for your work with River Valley Health Services and the CAP agency. I think with Lisa's presentation about community health and several of the things indicated, it's just we see a need for that. So thank you for your work there.
But let me just underline also, we have an excellent free clinic within our public health organization as well. It's called Health Matters. And every other Tuesday, we have a clinic in our government center that also is for folks that cannot access health care. And one of the big areas that we deal with there are vaccination updates. That's very much a part of what we emphasize when we have visits from our clients in that clinic as well. And representatives that I work with are from Stacy and Michael. I work with Jody periodically as well. We work together in that clinic to provide these services. It's great to have them.
Thank you. Appreciate it.
All right, I noticed the gavel snuck over to me here just a minute ago. I feel really powerful. Is there anything else you want to report here with your community health report? Okay, we'll take a
Motion to adjourn.
Motion to adjourn.
Second.
Second. All those in favor say aye.
Aye.
Good morning. We are going to convene the May 20th, 2025 Scott County Board of Commissioners. We are not going to do the Pledge of Allegiance because we did that once already. And we did also participate in a flag exchange ceremony with the SMSC earlier, which was an amazing opportunity. So we've done that. We will now move to item number 3, any amendments to the agenda. I did not see any, but I always like to look to make sure I didn't miss something. Otherwise, it will stand as distributed. Item number 4, approving the minutes of the May 6th, 2025 board meeting. Do we have any changes, additions, deletions?
I'll move approval.
We have a motion and a second. Any discussion? Seeing none, all in favor, say aye.
Aye.
Aye. All right, the minutes are approved. Item number 5, I love item number 5, recognition of interested citizens. Are there any folks in or out in the hallway that would love to come and talk to the board for any reason? Any reason, anyone? All right, seeing no one, we will move on to item number 6. 6.1, we're going to receive information on the Scott County Delivers topic, criminal justice system. Where is my daughter? She's not here. Take it away.
Good morning, Mr. Chair.
Yes. New AV, working the bugs out. Maybe that has our new microphones. We're
metal
working out some
detector.
new AVs. We got some new microphones. Katie's got the hot mic. Maybe not that one or less.
Are you wearing any other recording devices?
Oh, Jeff knows.
Okay, maybe if I lean away. Okay, good morning. Mr.
Good
Chair.
morning.
Thank you for an opportunity for another insightful panel as part of Scott Delivers. Today we'll be focusing on developments within our local criminal justice system, specifically the evolving trends in jail population and crime rates. This session was initially inspired by a thoughtful question from one of the commissioners, prompted by data indicating a decline in the annual average daily population of the Scott County Jail. In response, today's presentation will explore that data in greater detail. We'll highlight how, while the overall jail population has decreased, those who are booked are presenting with increasingly complex mental health needs. In light of these shifts, the county has invested in strategies to connect individuals in the criminal justice system with essential services aiming to reduce recidivism and promote successful re-entry into the community. We'll also examine some broader crime trends. Before we begin, a brief housekeeping item. We do have an amended page number 5, so if you haven't seen the latest packet, please look at that. And I would now like to invite our facilitators to introduce themselves and their department, and after they go, then we'll also have our fabulous panelists introduce themselves as well.
Good morning, I'm Tracy Cervenka. I'm the Business Operations Manager and Administration.
Brian Beasley, Facilities Manager.
Jeff Smodish, Employee Relations Director.
Carrie Lorenz, Community Corrections.
Amber Barnes, Supervisor of Coordinator Response.
Kayla Punchcard, Detective with the Sheriff's Office.
Jeannie Anderson, Scott County Attorney's Office.
Laura Perkins, Nursing Supervisor.
Caleb Madden, Assistant.
Hot mic, hot mic.
Caleb Madden, Assistant General Manager, Scott County Sheriff's Office.
And once again, I'm just gonna reiterate, new AV equipment that we're just, is this our first, this is our first deliverable matters with the new, yeah, working out the bugs, working out the bugs.
Danny Lenz, Officer Management.
Seemed very nervous, yes.
Budget. Lieutenant County Sheriff.
All right, we might make a few adjustments on the fly here, but yes, okay, we're gonna take a little sound check break. Once the bugs are worked out, it is gonna be amazing, amazing.
Must be mosquito control.
Oh, true, that is,
Is there
that
mosquito
is.
control here?
If in doubt, go old school or semi. So we just may have a little pause as we pass the microphone here and there.
Okay. We're wondering if having this on was possible.
Sure, let's try it. Let's work it out, real time.
All right, I'm testing. Nope, that's not. Well, I'm also the first person to ask a question here of you all. Did we already do the summary? Did I miss it?
Yep.
Okay, I'm sorry. So on page 9, that slide refers to the annual jail average daily population. And those numbers seem to have dropped, and I was just wondering if you could talk a little bit about what you think is contributing to that trend.
Well, I'll start it off and then I'll head into some of our detectives as well and things like that. Prior to COVID, prior to 2019, 2020, I think in 19 our numbers were in the high 130s, and typically trended a couple people a year. It went up in the average population each day. And now we sit around 100. So it's obviously a very dramatic change, but I think there's multiple pieces, and some we'll get into around reentry and the social worker in the jail, just pieces we do. You've heard updates on treatment court, veterans court, all those things I think combine. I think there's no magic bullet here of what changes it, but a lot of things. And then for the jail operations, I would say mainly it's investment in the courts. So adding those courtrooms and judges that happened, the additions over there. The system just runs better, the pre-sent investigations, all those things are happening quicker, and that means there's a turnaround quicker of people getting to see a judge when they can. As the sheriff, I have no control over the population. I don't decide who gets arrested, I don't decide how long they stay. It's the courts and all the behind the scenes that happens that talks about efficiencies and has become a more of a well-oiled machine in how people are seen by a judge and moved on to the next thing. And then we are doing things in the back end that hopefully prevent them from coming back as quickly or if at all. So that's the main part. And then there's a piece too, I'm gonna hand it down to Detective Punchkar just to talk about even some crime trends that have changed, where when I was a detective, we were doing, especially in the summertime, multiple burglaries a week, just things like that were happening a lot, and now the crime has changed a little bit too, so we're just not seeing some of the same interactions out in the community as well around crime.
So my piece is to talk about different scams and uptick in different crimes that have been occurring since what Sheriff Hendon said was, traditionally burglaries, is now we have crimes that occur online. So we have different scams that occur through different platforms. Facebook is a big one. We also have an uptick in like Bitcoin, cryptocurrency frauds that are occurring. Within the last year, the legislator in Minnesota passed a law that makes it you can only put in up to $2,000 currency in a cryptocurrency machine that you'll find like at a gas station or whatnot. And that has helped significantly in limiting the amount of money that our citizens are able to put in at one given time. But in addition to that, there is another law that allows us to get the money back from the crypto machine company if they are a new customer. So far I have investigated 3 of those with 100% clearance. So
Wow.
That's been very successful, and we're really glad for that.
Wow.
Sure. Okay, I got two mics, all right. So one of the questions I have is, Scott County is unique, as they call it, in an entertainment, right, capital. And with an amphitheater coming soon with a capacity of 20,000, how unique, what does that have to do? I know page 5, you look at felonies versus gross misdemeanors. How do you adjust that focus and change having that different dynamic in other counties? Is there an impact that way?
So like for the amphitheater specifically, you know, it will be a lot of events and a lot of people, but also in the past when they've had large concerts like that, we don't see like droves of people come to jail. You know, it might drive up a couple of deals, but a lot of them at those facilities do a good job of at the low end with security and stuff, like not over serving, getting people out of there before they cause a big problem. So we don't see a big uptick in that, but definitely the venues in our community do drive up. You know, there's tens of thousands of people in our community each day visiting different entertainment venues, so it does drive some of our filings and police activity, you know, that does come through, but not a huge driver on the jail specifically, like I said, on a concert venue. And then also in talking to county sheriffs around the state too, it seems like everybody, if you look at their daily population, does have a large proportion of people that aren't residents that are in custody, and that to me is more of the factor of how crimes are committed. Somebody going around doing, say, credit card frauds at gas stations, right? They're gonna hop in a car and they're gonna make a loop around the whole metro and eventually get caught, but they're gonna have filings in all kinds of counties, not just where they live. So a lot of just crime, or you look at addiction issues and that people are on the move and doing things kind of all over, so they end up landing in jails all around the metro. It is very common, but I think Jeannie can probably speak to even the filings as well.
A little bit to the filings, but generally speaking, what we see with those smaller charges, the misdemeanors and the petties and stuff like that, they stay about the same. They go up and down a little bit, but they change more year to year. So I don't know that we're anticipating a huge increase there, but we would tend to see it going up and down normally anyway.
Kind of a follow-up question on that. Kind of a follow-up question on that. Can you tell us, because when we look at page 5, you know, it talks about the case filings by most serious charge level. What else is there to that? That doesn't tell us any specifics about the offenses. Can you talk to us about the complexity of cases that your office is seeing?
Yeah, so we are seeing the cases go down in number for some of those more serious offenses, the felonies. But the severity of the cases that we're seeing are still staying pretty significant. We're seeing like the murders and the really significant assaults and that sort of thing still in those numbers. So even though the overall numbers go down, that general severity level that we see is still staying really high and increasing the work that we have to have involved in it, particularly when we think about like body cameras and the evidence that's coming in. Even though there's fewer cases, we're still seeing a significant amount of work and actually an increase because of how that is coming to us with all of that data and the fact that it is kind of that electronic piece instead of the papers that it used to be, having to wade through all of that stuff to figure out where the important pieces are, and being responsible for having all of that is creating a lot more work even with those cases. And then of course, as far as the jail is concerned, we're seeing some of those other mixes of the population that's coming to us having those Rule 20s that are filed and people having those higher levels of needs for those offenses and those more serious offenses that we're seeing.
And Katie, if I could add to that, since we don't have a local paper anymore, people don't know. Like for instance, right now we've got 4 murder cases going on. Jury selection starts on one of them on Tuesday after Memorial Day. So those murder cases take up a significant amount of law enforcement time to investigate and a significant time of my attorneys to prosecute, because it's going to take 2 attorneys to prosecute those murder cases. A complex crim sex case, which those numbers never seem to go down. So like Jeannie said, the complexity and the time involved in going into these major cases is really quite significant.
Is this on now? All right. Well, I apologize because I think you all may have just sort of answered my question that I had prepared, but I want to validate this. So if I look at page 5, right, the number of gross misdemeanors has kind of flip-flopped above the number of felonies. But when I look at page 11, the inmate bed days by offense level, that number of felony days sort of staying static. Is that indicative that the complexity of the cases, while the volume is dropping, the complexity is maintaining high, or is there something else at work when I look at those numbers? Because there's a bit of a tension between those two things.
Well, I can speak to the bed days and the severity level, because we have like those felonies and those gross misdemeanors where the real 20s are getting filed, for example. That extends the case because you have additional hearings and different assessments that have to be done and that sort of thing. So that's going to increase those bed days on those cases alone.
No, I think Jeannie really covered it. That is definitely what happens. And then also some of the other behind the scenes stuff of the courts, you know, the law changes, things, gross misdemeanors, they're getting people through the process a lot quicker. And the people in jail are the people we should have in jail, you know, with the serious felony cases. But it's totally true. One person sitting on a murder case might sit for 1.5 years waiting for trial. That can, you know, skew the results of a bunch of people coming on the weekend for DWI or domestic very quickly when you look at the total bed days.
Can I ask a quick follow-up? Is that, all right. And what metrics, if any, are we tracking or buried in here that I may have missed that sort of speak to that increased acuity? Because I've heard several of you, and I know that's a conversation we actually had, Caleb, some years ago about, you know, how we try to monitor the acuity of our friends in the jail to sort of try to, again, you know, assess how much more work it is, even though the volumes are differentiating. I think that would be, is there anything in the works?
Yes, absolutely. You know, I think that the main basis of that question has been answered. There's a lot more administrative things that kind of go along with this. I think the efficiency that's been realized with different parts of the county and the courts working together has really brought some of that time down. So Rule 20s, and I'm not sure if it's in the packet, I'd have to look here, evaluations of inmates are much better. They're happening much more frequently. So I guess the data is not in this packet, but that would speak to that task as being something that just works much better now. Thanks.
Just a little bit. On page 12, that data talks about inmate healthcare visits. And it seems that the doctor and ER visits have really increased, and I'm just wondering if you can talk a little bit about the trends that you're seeing in healthcare needs in the jail.
I'll start this off and then hand it off to Laura. So we do see certainly an increase of people going to the emergency room. I think it's twofold. The reason that the data is showing that, one is the complexity, just like Jeannie said about cases, the percentage of the cases that we have in jail that are complex cases has increased. Same with medical needs. We see people with much more complex medical needs, oftentimes coupled with mental health issues that require a doctor to see them immediately. And then I think the other thing I'd really consider is the way we've looked at reporting to the Department of Corrections more accurately when people are going to the emergency room. You know, and I think that's just showing some of those things more that maybe it was happening before, but wasn't showing up in the data, and it is much more accurate now.
I think too that over the since COVID, we've started seeing inmates sooner. So before it was, we followed the DOC standard of every inmate needs to be seen within the first 14 days. We've now increased that to seeing everybody within the first 72 hours. So they're having a nurse contact visit possibly before they're even going to bail hearings, which sometimes when they come in, they don't necessarily give all the true information about their medical needs. They are waiting until they see somebody in a medical uniform and they're being honest and giving those medical needs. That too, we are sending more people to the ER because we're seeing them more often and sooner when they're coming into custody, and a lot of our population have complicated medical needs to where they need to see the medical doctor. With the doctor being there twice a week, we're just putting more eyes on them and having that face-to-face contact versus just reviewing charts.
So I'm going to look at page 15 in correlation with 8, delivering reentry assistance program. I see that started in 24 and 25, and then multiple bookings have gone down when you look at, say, 3 and 2. Is that really helping with recidivism, lowering the people coming back as we're offering those types of assistance?
I mean, I don't know that we know that for sure, certainly, but just within this graph, it just indicates, I mean, there's multiple things that can happen with people in custody. And so there could be, one person could have 6 services that they're requesting. And so, I mean, we'd like to think that, yes, by us facilitating that and helping clients with that before they leave the jail, that ultimately the goal is for them not to come back. But I don't know that we have anything that we can say for sure I think it's definitely a factor.
As kind of in regards to the reentry services, in the narrative, it talks about a delineation between the jail social worker and then the jail probation officer. Can Carrie and Amber talk to that and tell us about the efficiencies that has created?
Yeah, I would say we worked really hard, both Carrie, myself, and our managers, to really try to delineate and focus on, while the roles are different, so they sometimes do have an overlap of things that they do, but they also have really unique specialties, and so we really wanted to work on highlighting those. So I would say over the last, I don't know, maybe year, maybe 6 months specifically, we've really tried to internally delineate what is the social worker's role, what is the reentry worker's role, and really the goal is we don't want inmates to have to know who does what or correction staff to have to know who does what. We really wanted to make it an internal delineation. So some examples of a social worker role. Our current jail social worker, Peyton, is fully licensed as a mental health professional. So we really wanted to highlight some of those skills and experiences. So right now she sees anyone that might have a mental health diagnosis, anyone who sees Wendy or Dr. Kennedy for psychiatry. A lot of inmates that come in are on a civil commitment or are going through the Rule 20 process. So Peyton helps coordinate with that. If there's any like medication refusals, I think we're trying to start with maybe Peyton having to do some education to inmates of the importance of medication, psychiatric medication. She reviews inmates from like Laura's list, anyone that's maybe seen by the mental health center for a crisis assessment. Peyton can do a lot of follow-up visits on that. And I'll maybe let Carrie speak to the reentry role.
Yeah, so Alexis is the probation officer that's actually housed at the jail. That started in January of '24. And I think the majority of her time is spent doing just coordination, especially with treatment stuff. So she's doing, coordination for comprehensive assessments and trying to get clients out into treatment. And so a lot of times you'll have the courts that'll order that a client can be released upon a treatment bed. And so then she's just doing all that coordination with the client, with the treatment providers. And it's not just Scott County clients, she's also coordinating with out-of-county clients. So she's coordinating with Anoka County, Hennepin County, Dakota County. And the nice part about that then too is some of these clients will have holds in other counties or warrants in other counties. So she's able to coordinate and hopefully facilitate those being either quashed or different court dates so that clients are able to get the services that they need and they're not getting released and then picked up on another warrant. So just more effective and efficient.
Try your mic. I think the mics work.
No squeals yet. All right, so I'm going to refer to, and I don't know, maybe you guys can tell us the trend on this, in inmate healthcare visits with 12. Is there a trend with age that we're seeing from a younger to an older, and how do we adjust that with healthcare in Scott County?
So I would say at this point, right now, we're not tracking the age of our population. And that's just, I mean, we most definitely can. It's just something that we have not tracked over the years. I will say that it seems that even if they are younger, they've been coming into custody, no matter if it's with us or other counties, more frequent, and they just have more underlying comorbidities due to their drug use, mental health, the non-compliance with taking care of whatever chronic conditions that they have.
I can say anecdotally, well, we don't have data to support it. We do have a population that's somewhat older than when I started working here 18 years ago. That's changed. Why, I don't know, but we see that as a difference. Yeah.
A little bit cart before the horse from me. Apologies, but Brian keeps stealing my questions. Just directing your attention to page 12, if you could just, and I think I'm probably directing this to you, Laura, if I may. Just talk to me about this slide. Again, I see the blue column comes in new. There's, some numbers stay flat, other numbers drop. Can you talk to me about how that all interrelates and what changes may have occurred, just sort of high level? Again, apologies for kind of going back to the open end of the funnel.
I'll start us off here real quick. I think part of this really supports the premise that we have more health care professionals working in the jail. So we're able to have better responses, more efficient responses to deal with this. So I think that is a big part of that. We haven't found the saturation point where the need is being met yet. We don't know if we've hit that yet. We do know we have people with very complex medical issues that are in the jail, and we just don't know at what point we're seeing people more frequently. We're providing that medical professional as soon as possible, and we're seeing that need being utilized. We haven't seen a point where it kind of flattens out after that.
When I look at slide 12, the column 2024, the nurse visits, health assessments, I mean, that's the first year we're tracking those. I don't know if that's something new we rolled out. But then I look down below the nurse visit sick call, that drops to 386 from 661 in 2022. My mind thinks there's a correlation, but in 2023, we didn't have the health assessment and those nurse visits dropped. Again, just anything that changed in our policies, process, or regulations that correlates to that change so that I can understand.
So I would say COVID changed. So 2020, 2021, we were doing COVID rounds every single day, which we would go and ask all the COVID questions. At that point, it gave them a chance to say, I have hypertension or I have diabetes. We weren't tracking that as a sick call or a health assessment at that time. So yes, we were making contact with them in 2021 as 633 times we had inmate contact. Then 2022, we were still doing the COVID rounds. 2023, they started to lighten, so we were seeing less people. Looking at the data from 2020 to 2023, we knew that having that inmate contact was them having us address their chronic conditions. In 2024, we put in the standard that we wanted to meet with everybody within 72 hours for a health assessment. Those nurse visits and sick call never went away. Those were just inmate requests, that they requested to see a nurse for whatever reason that may be. I think that's why there was the change, and we were tracking different things and starting to put new processes in place.
Thank you very much. That's helpful.
If we look at page 6, criminal drug case filings, we notice a general downward trend. But what I've heard you all say to some degree, and is reflected in some of the jail reentry services requested in regards to chemical health help, can you talk to me more about this data from a multi-system approach? So we have drug case filings going down, but we're still hearing that there's a need for that.
I didn't catch all the question. I was looking at the microphones over here, so sorry, I'm a little distracted. But definitely the case filings, there's a couple pieces. So you're talking about the criminal drug case filings, looks like. Yeah, so there's some changes in state law that happened during that period of time of you think of some of the minor, a trace amount, you know, prior had been a felony, became a gross misdemeanor, kind of becomes not an issue. So some of it was around that. There's the marijuana, cannabis type laws change as well. So some of that did drop down. And then also during, you know, COVID and stuff, you think of there was less contacts in the community on purpose, so less traffic stops, less, so you're going to find less stuff. And then you look at some of the shortages at some of the police departments in our agency at times where if you're running minimums, like traffic enforcement is the thing you do after you're caught up on everything else. So if there's calls going on, traffic enforcement isn't getting done, you know, versus if you're fully staffed and there's somebody free, they're out doing that. So some of that is just all a combination of some of that activity levels were down quite a bit with some of those changes. But like I said, mainly a lot of statute type changes too, that a lot of those lower level things aren't becoming somebody that gets charged or brought to jail on that.
Can I just say something to bounce off that? I think that even though we're not seeing the drug charges, it doesn't mean that we're not asking the questions once they're in custody if there are chemical dependency issues. So even though we may only have 10 people that have drug charges, we potentially have 25 people that have other charges that do have that chemical dependency, so we're referring them out for chemical health services.
And I think from our office, we never want to say that, oh, it's down and it's never going to come back because we're the pessimists that we are. But it's a situation, I think, where we don't have any good answers for why it is the way that it is. We all kind of have some anecdotal theories, but we haven't seen anything that's actually said that this is why it's down or that it's going to stay down that way.
Looking at slide, or page 8, oh, I'm sorry, looking at page 8, the multiple, the number of jail inmates with multiple bookings. I'm just wondering if you, oh my goodness, I'm so sorry. If I move it a little bit away from you. Wondering how that data helps inform your work, the work that you do. And
So I think for, you know, what we see in the jail, this data reflects a lot of different things. So it could reflect somebody who's in on one charge, they were sentenced, and then they're serving weekend sentences. And it'd be, you know, they might be booked multiple times. So it's not, doesn't all speak to recidivism. It might be what they're being requested to do by the courts. The other thing is we do some trading of housing with other counties, which really helps us balance some of our concerns and other counties to do that as well. That's worked really well, but what happens is a person is released from the system, they're booked in that other jail, and then they return to us. Well, they've been in custody one time, it'll show 2 bookings. There's several different things like that or similar to that would show that same data. I wish it was maybe a little better for to speak about recidivism, but I really think it shows a lot of administrative function.
And one idea we had going forward, and this is all a manual count as well, you know, we pull all the bookings and sort them down by people, but I think digging into the individuals on those higher levels and actually seeing what it was, we could probably parse out what's recidivism, what is, yeah, somebody got arrested on DWI here, and then 6 months later is a Hennepin inmate, and we're boarding them, and now that shows us 2, you know, just to look into the story of each one of those, I think might give us some real more accurate of what that looks like, because there's obviously an issue if somebody's getting booked 6 times a year, right? But we want to make sure it's the right issue. But so I think we could dig into that data in the future a little better.
So I'm going to ask this question like a broad brush. You guys, however you want to answer it. The first one is obviously offenses per 100,000, right? That really, to me, is the gauge of how safe your community is. What is Scott County's greatest influencer of crime as far as trends right now? I'll give you a fun one.
And this one's a tricky one too, because it's county-wide data. So, you know, our police departments all have an impact on it, and but those trends nationwide and statewide as well have been slowly going down, those serious crimes as well. But yeah, there's not a ton we control because we're out in the townships doing those investigations in Credit River, our cities, but you know, it's reflective of the the good policing that's done in the community as well, you know, by the staffing levels at our cities and the enforcement or the cooperation we do to get to the bottom of things and solve them. But definitely those trends do continue to go down, but they're hard for the public to see. As Ron mentioned, you know, we don't have newspapers, we don't have a lot of that stuff, but you have social media. So some other things, like I use the example of burglaries, we don't see a lot of, but when somebody's car gets rummaged through, they may go on social media and say, I got robbed last night, right? Well, robbery is a very serious offense, right, of being taking something from a person. You know, so some of it, there's a feeling that crime is the same, but the data, because our population grows, that per 100,000 number continues to just go down. But it's hard for a public perception piece to see sometimes that crime is, you know, because we still have 4 murders going on. We still have, you know, things that happen, but also 25 years ago when our population was in half, right, you know, the amount of murders have a difference in that. So the population does drive that there's going to be crime, there's going to be activity, but overall it definitely does go down. But, you know, I think, I mean, some of the stuff probably on more the back end, the reentry, the different things that are going on, the way we monitor people on probation, right, all is having huge impacts on that. And then going into the early learning, reading, all those things we do have things that we can't measure, but years later, they probably do have huge impacts, right? And on getting to the core, or even the mental health work in the schools. All these things that we do as a county, I think, probably impacted more than we know, but it's also impossible to see what that number is, you know, but the trends lay it out, I think, that there's some work being done that makes a difference.
So to shift, because I was looking at page 9.
Jeff, I just want to interrupt you. Can you please refrain from using the word shift? It gives us, you know, PTSD when we hear the word shift. Sorry.
I will.
But you're not the state. You're not talking. Okay, sorry.
We're listening.
Sorry. Yes. Shift is allowed. Sorry.
Looking at the average daily population of the jail on page 9, I want to ask a question that, again, it kind of, we're drifting back, it's more basic and maybe everybody in the room knows, but is more inmates in the jail, we think for certain reasons would be worse, or more inmates in the jail better? Is it a linear progression, or are there stage gates or points in the population growth of the jail where it's more or less efficient? Why does this matter talks about this all determines the care of costs for inmates, et cetera, so I'm thinking about that. I used to work, as some of you all know, and just to give some background because I'm realizing it's a bit of an inscrutable question where I was going. I've worked in healthcare for a number of years, and right in certain areas, in like an emergency department, you have what's called a circle unit, or there are pods. There seem to be some similarities with the jail. And right, if we have 4 pods at United Hospital in St. Paul, we want to be operating on like the maximum number for 3 pods, because if we get one more patient and we have to open up the 4th pod, suddenly we have to bring on all these other nurses, not using the S word, and that's an expense to us. So there's a magic point, like we want to be at 13 patients on 4,300. Is there anything like that at play here in the jail? I think there might be, but I don't really know.
Yes, I think in asking the question, you already answered it.
Yeah.
That's exactly how it works. You know, we have pods in a jail, and there's different classifications. We're required to keep people, you know, separate based on gender, their risk level to you know, be assaultive towards somebody, or maybe they need protection. So we have these different areas in the jail, and once they hit a certain number, well, then we'd have to open another area for that.
And to what extent, if any, have we thought about that impact, or does that inform when we board, or how we structure to avoid having the maximum number of pods open, or to have only pods open that are sort of fully filled, to use a really redundant term?
Yes, no, I think that's a daily conversation that we have at the jail about how to best utilize the space we have. Oftentimes we can't combine things, but we move people around to accommodate for those numbers, and it certainly affects our decisions in boarding for other counties. That's something we're interested in doing. However, if it affects our staffing, we have to take that into account, that there's a cost involved with that.
And the last follow-up, I don't mean to becoming very unpopular, mostly with Caleb. Are do you know, or Mr. Shepherd, are we aware of any changes at the regulatory or state level that might impact our ability to manage that population and might impact the cost of running the jail or take up some of our flexibility away? Anything that would impact this in our calculations?
Yes, absolutely. So right now, 2911 is the rules that govern jails in the state of Minnesota. Those are being rewritten. They're going through a rework right now. I think a timeline to have them out is January of 2026. What we're seeing out of that is significant constraints and places that we're going to have to change the way we operate, basically, and that is going to have an impact on how we staff and how people are housed, which would lead to increased cost.
Board Relations is here to help. Nice. And just to follow up on Jeff's question too, is the difference between a hospital as well is because of our classifications, we can't constrict as easily. We can't say, let's just close this housing unit for 2 months because we're down low in here and combine classifications because the DOC rules do govern how we staff them, how we classify people, and then the ratios of inmates to, so it's a little challenging, but the building is nimble. We do some stuff time to time to move people around to try to keep that down, but it'd be super nice if we could just close a housing unit for 2 months. And then because of our licensure too, we have to get approval from the DOC every time we do anything dramatic like that, because they need to look at it. What, you're gonna combine maximum, minimum inmates, why? It would be one thing if we were down staff and they're like, okay, for a month or something is okay, but for us to be like open-ended, we're gonna move them. So there is a process that goes into play too of how we're approved for our staffing plan and licensure and stuff that, but like I said, our building being newer, we have a little more flexibility. Some of the other metro jails that are a little bit older, even the way they're constructed, is making it very difficult to meet some of the DOC regulations too, is just how many people, how you have eyes on a cell block and that. So we do well there, but it's tight, it's hard to, so the boarding usually works out good for us when it's a need, because we already have to staff that area, and adding 15 more people or something wouldn't change any of those outcomes. And then, like I said, the total cost of the operation is dependent on that, because you're spreading out costs over, you think of the kitchen vending contract or laundry or stuff like that. You still have to do those things, so having a few more people doesn't really change those costs. It just, spreads them out over the population a little bit.
Thank you so much.
Yeah, any question up here?
Yeah, I was going to ask a question in this category. It's been sort of covered already, but I want to ask it and clarify it maybe in a different way. If you said you had 100 and you're staffed appropriately for 100, but you could really, with that staff, take 130, or I would like to see us track a boarding goal, in terms of the staffing you have. If like I said, if we have 100, showing that we have about 100. But if you could really take 130, then we ought to have a staffing goal and be approaching other counties and say, hey, we have space, we can take X. I would like to track how we're doing on that.
Yeah, and we could take, Caleb, we could handle 150, 160 a day probably with our current staffing. It gets, once you get in the higher numbers, it gets tight. If the right amount of people come in from a certain offense, then you have a little shuffling to do. But the challenge is more supply and demand. So since we've built our building, all the metro jails or most of the ones in the outskirts have been replaced since then, so the demand isn't there. So like right now, we had Hennepin for 6-8 months last year. It sounds like they may still have some need later in this year, but we ask and we do search, but there's not a demand. There's not a need right now for county jail space is kind of the issue. So we'd definitely be taking them if there was the need, but it's a little bit of a struggle to find the need right now because of just all the jails were updated.
I also kind of wonder on the category of that word we're not supposed to use, shift, but when they close the Stillwater prison, are you kind of wondering, what is the state going to do? Are they going to try and send populations back to jails?
It does reflect back to, was it 2008 when they did some of that stuff where they changed some of the sentences? I believe I wasn't in this position then, but yeah, they did. The state did end up cost shifting some things, but saying, if it's this type of sentence, you're just going to go to the county jail. So that could be. We haven't heard that as a part of the plan, but I know that has happened in the past where they do some slight shifts to keep their numbers in check and don't really pay us for that. They just kind of change the rules.
Yeah. I have one more question if I could. On the idea of recidivism, and and reducing that. I've always wondered, I don't know the current status of the amount of programming in our jail, but this is like a broken record. I've mentioned many times over the years. When I was more aware of our programming in other county programs like Dakota, I'd say, boy, their programming is much more robust than ours. And I don't want to do programming for programming's sake, but if that has a way of helping reduce recidivism, I'm trying to say that, but that's a good thing, you know. And so I'm kind of wondering, should we be tracking programs and attendees in programs in some way monitoring how we're doing on that?
Yeah, and a lot of our programming history was staffing level issues. So our staffing levels were low, we'd have turnover, and the programming person would get pulled to cover shifts. So we really had issues there. Now that we've been stable for the last 2 years, I think now our program people are getting more mature in the processes and building up some of it. And Caleb, you can talk. I don't know if we actually measure the specific attendance, but you can speak to that.
We do actually measure the specific attendance, and I would completely agree with you that maybe 5 years ago, Dakota had a much more robust programming schedule. I think we're catching up significantly on that with adding programs, especially programs that are specific to problems that inmates face. That's always, you know, we're trying to get programs that will be helpful to people, especially as it relates to recidivism issues. So parenting classes, that's something we're actively bringing in. We've sent our programmers to a new class to teach it's a class regarding coping skills, just how to cope with life, how to cope with emotions. And we see a lot of engagement with that, which is really great. I would completely agree with the sheriff. This was, for a while, our staffing was so tight that we're barely making a buy to get programs to inmates, and now we have the ability to do that. And it's really, really neat to watch our people, you know, they're interested in that. And
very good.
It's neat to get them involved.
Yeah, thanks.
I'm just going to stay, thank you, Mr. Chair, on this same topic, because I'm going to ask the opposite of Commissioner Ulrich, because it's like, as we've seen the population decrease, and we know that a lot of our counterparts have excess capacity, and we also know from our own experience that our per diem might cover marginal costs, but not per person costs. Have we looked, or are we starting to look at the thought of, you know, decreasing our population or not increasing our staffing, and then utilizing if we go over, because I know that's a fear, you know, all of a sudden we have 10 more people or 5 more people. Is there the capacity out there for us to board to really, you know, I mean, it seems like we have a trend here where we should start looking at that.
Yep, and we have been looking at those numbers and what the break-in, we were talking with Danny about a couple months ago, had a meeting just to kind of discuss some of it. Some of it is the break-even though as well, because if we board, say, 20 people out, and then you look at what that costs for a month, all of a sudden, oh, we didn't really, you know, so there's a break-even, and then back to the classifications, you'd have to do it based on, all right, we're gonna send all the females or all the maximum, you'd have to pick that group so you could actually close the housing unit. And one thing we talked about is talk about some of the challenges of the inmates that have the serious medical or mental. Yeah, their county's not gonna want them, right? Because they're not gonna wanna inherit that risk and workload. So then you get in the problem of, if you wanna eliminate a whole group of classification, you know, and get 20 people out the door, it's still challenging because there are gonna be the one-offs or more than one-offs probably of those. So it gets to be a little bit of a mess. They're trying to figure that out, but there is definitely some logic behind. I know the state did a study last year on regionalization, trying to look at, and I went to the meeting and I was like, I think I'm the only one color on the map of a county that responded that they liked the idea. It's like, what? You know, like there was just no buy-in, and some of these jails have 3 to 6 people in a day, and they're not interested in regionalization. You're like, that's where it would make sense, you know? So I think hopefully over time that thought gets, because that would make sense of some of these issues of, you know, combining some of these smaller counties or a close neighbor and sharing, or dividing up, like I said, some of the workload. Now, the other issue is when you do house out, people are generally coming back to court pretty often too, so there's this churn that would happen as well of getting people back and forth, you know, but, because a lot of people aren't here for a long, long time, but yeah, it's complex, but there is something there of trying to figure out, but it's finding the right way to do it that you could actually save money and not, save us maybe a small amount, but then look at all the extra work you're doing and figure out you're kind of chasing your tail a little bit, but it's a little wiggly. I said it'd be way better to have more of a regional or statewide approach to some of this, I think, of of kind of solving some of these problems.
Thank you.
Yeah.
All right, thank you. I have a question directed for Detective Punchakar. At the beginning of the meeting, you talked about some of the changing trends and what you're seeing, and you spoke about some of the online trends. I was wondering, how does this impact training for officers, and what does that look like?
Yeah, it really does. It's kind of a whole new idea of investigating. Some of us are more tech savvy than others, and some of us, quite frankly, just enjoy investigating that more than others. We have been going to a lot of trainings. We have some locally. I think last week there was one in, just locally in Shakopee that we went to. We are kind of going all over the place trying to just get a grip of how to investigate these. We also network with different agencies. We work with each other. The investigators in Scott County have a group that we work amongst each other with. We work with different BCA and federal agents as well, because someone may have worked it before and there's no sense reinventing the wheel. So we're all learning.
That harkens back to another thing mentioned in the narrative, talking about how there's some challenges with a lot of these new crimes being more cross-jurisdiction. Can you talk to us about that a little bit?
Yeah, it is a big challenge. This morning I was talking to my partner about one that he has ending up somewhere in Florida. And he's like, now what? I'm like, well, we're not going there, unfortunately, right? Although we might wish maybe we hold that for January. So we do work with lots of different jurisdictions weekly. And it may be that we call down there and see, who lives at this address. Sometimes that jurisdiction will follow up for us. Sometimes they end up overseas. And, that's kind of where this new law with the Bitcoin in particular that lets us get the money back from the kiosk company comes in handy. No, we're not getting the money specifically back from the suspect, but then that kiosk company, the hope is they will have higher standards for everybody as to who they allow to use and who will become a victim and their clientele as far as the suspects.
And I just want to fill in a little on these Bitcoin, just to give the reference to, these are the ones where you get the fake call of, this is, Lieutenant Lane at the Scott County Sheriff's Office, you missed a jury, notice, you're gonna get arrested, and they get you on the phone, they do this high-pressure sales, and people will drive to a Cub Foods and fork over money into these Bitcoin machines as all part of the scam. And I mean, we had some who went 3 locations at least, maybe more, where they'll convince them, okay, now you put $3,000 in that one, go to Burnsville, put it in there, and they'll literally $9,000, $10,000, some of these folks will. So, yeah, so part of that law is we're not actually catching the bad guy, but the vendors who are allowing this transactions to happen are getting punished. They're having to reimburse the money if it's a brand new customer who's never used Bitcoin machine and shows up and just does 3 transactions. Maybe you should have better constraints on your business. But so it's been helpful, but it is complicated. And then a lot of these too, people will call us and be like, well, here's the phone number of who the scammer is, and here's the email address. Well, they're all fake, is the other thing. So some are even across country lines, that are using technology to mask, who they are and where they're from. So they hit really quick dead ends, or they're using VPNs and things too, that it's the technology piece. If you can do subpoenas and search warrants to try to ID them, and months later, you just hit a dead end sometimes because of the way they figure out how to mask, their identities. So, thank you.
Any final burning questions from our facilitators?
I do. One burning one I have is one that was actually really important to me in my former career. I worked with, as a city director with the Department of Corrections in New York, Shock Monterey, and we collaborated between a city and state level where I brought inmates down and worked with them, gave them opportunities to learn even with felonies, trades as far as painting, concrete, you name it. It was a successful program that we did for 6 years. It lowered recidivism down to 7%, lowest in the state. But I found, and why I took it to heart is I actually went out and worked with them every Friday. And I found that each one was unique. Whether you were dealing with a veteran or somebody that made a mistake with a petty crime. So, for me, when we look at jail reentry, and it's amazing what you're doing, I can tell you there's a difference from the people I worked with from a veteran that sometimes don't want to open up. They don't want help. Can you explain some of these unique situations you're running into and how you're helping them get back on their feet? Because when they come back in the community, we want them to be successful. And what I found out, and when I spoke with them, even from the director of corrections, Leroy Fields, is a lot of them, when we help them learn these trades, and contractors, where they have felonies or not, are able to go out and contribute to a community and get a job, they now have opportunities. When we don't give them those opportunities, they just go back to what they know is committing a crime. So I'd like to hear a little more on that.
Yeah, I would say we are seeing much more acute mental health in the jail. Laura can probably speak to the medical issues we're seeing in the jail that historically we just have never really had to deal with. So I think we've had to get really creative on some cases. That's so funny that you're talking about that, because I just was speaking with a Dakota County jail social worker, and in Dakota County they do they incorporate like art therapy for some of their inmates, and then they just had a big art show where the inmates got to display their art, maybe at like a library or something, and sell it. And so, you know, being able to connect with other counties of like, what are you guys doing to help with kind of these creative situations to address recidivism is always something that I'm trying to do by networking. But yeah, we lean a lot on our mental health center. They do an incredible job for some additional programming, but yeah, we're seeing just a lot of new things in the jail that we haven't seen historically. We're having to lean on other departments within the county. I don't know if you have anything.
Yeah, I mean, Alexis does a lot of the same things too. There's a group within the state that she belongs to that they just do a lot of resource sharing. And obviously we have clients that are coming here from other counties, so they can't necessarily utilize our services. So she's just networking with whether it's the Department of Corrections or the different county folks that are doing the similar work, so that they can kind of just build those resources and build those connections, so they can make those phone calls when, hey, I've got, you know, so-and-so here from Dakota County, what can I give them, you know, as far as resources go?
Yeah. And 2 years ago, maybe 3 years ago, we started the resource fair at Scott County.
Yeah.
So for those who aren't familiar, every like fall-ish, I think we host a resource fair for inmates. We have outside community providers, maybe like a substance abuse agency, like a parenting class agency, whoever it might be, physically come into the jail, and then we let kind of like a job fair, right? We let inmates go around to each one of their booths, learn about their resources. They can apply for health insurance during that time. They can apply for like SNAP benefits through the county. And so that has been a really big success, and that's something that we're gonna continue to do at Scott County, so.
Our, you know, I think we had about 24 vendors for that resource fair.
Yeah.
Which is, we went and observed one in another county, and I think they had 11 vendors, and we were really impressed by it. So we reached out, and our programs team, our social worker, community corrections, were all able to generate 24 vendors that came in and met with all of our inmates. It was great. I think, you know, as far as programming, one thing that's really important, and with Peyton and Alexis, you know, working on our teams, our programmers at the jail are able to really focus just on working with inmates and inmate programs. And that's been a big change, and will continue to be, you know, we're able to really grow that some of that recidivism, or possibly recidivism reducing activity that we can do.
Thank you all. I'd like to take the opportunity to turn it back to Mr. Chair and the commissioners for any additional questions at this time.
Thank you so much. Members, any further questions from, yeah?
First, a comment so we don't lose it. I just have to say thank you and congratulations to these departments, because if we think back to a little more than 8 years ago when we first started, our numbers looked different, crime was higher. There wasn't good coordination with our reentry. So much has changed. I think we should be really proud of the progress we've made, you know, and I think sometimes some of you out there might look to, just me, I can't speak for everybody, like, we're working hard, why are you trying to make us save more money and more money? But, you know, that's the result, is that if we do a better job, it's better for everybody and better for the taxpayers. So first, congratulations and thank you, sincerely and seriously. And then just one thing that I don't think we touched on, and I know it's only a person here or there, but they're a big user of resources. Tell us just a little bit about when we have to hold somebody who's mentally ill and dangerous, awaiting placement, what we've learned or what we're doing differently. I don't think we have to go backwards, but, you know, just where we're at now and what we've learned to make that be the least harmful situation for everybody involved.
I think we have seen a decrease in that. Last time we were measuring it, we were looking at about 6 months from the time someone was ordered to be placed in a state facility and when they actually arrived there. We're closer to 90 days right now. So that time difference has made a difference. All this stuff we've been talking about with jail programming, with having a social worker, having our work with the mental health center, in collaboration with them to provide support while they're there has been helpful. It is still very difficult to house someone who has significant, you know, emotional or other concerns that are, you know, they're really struggling with and they need treatment for. So that we're just not designed to take care of. It's tough, but we're doing our best to respond to it, and we are seeing that time has gone down, that we're hanging on to them, so it's been beneficial.
I would just add to that, Commissioner, thinking of our, Scott County has a handful to maybe 3 that are deemed mentally ill and dangerous, right? And that's like the most intense level of a commitment that you can get because it's indeterminate. The most recent one that transitioned from our Scott County Jail to St. Peter, because the jail did such a great job of trying to engage him and Dr. Kennedy was working with him and he was med compliant. Once he got to St. Peter, he was able to transition through their programs quicker because he was pretty stable, right? Probably compared to other mentally ill MIND individuals. So I think our jail does a really incredible job from all aspects of really trying to engage those people that are unfortunately just sitting there waiting.
Thank you for that. That's really good to hear and really, really good for all of you to know because I recently toured down in St. Peter and saw those different levels and understand the resources and just everything that goes into it. So the fact that if we have a citizen, a friend or neighbor, you know, these are people who need to go there, the fact that they maybe aren't going to be there quite as long or all of their lives and can get through that is really, really a great thing for everybody. Thank you.
Thank you. Any other questions? Otherwise, I'm gonna, can you go to, I'm looking at it on my phone, so I think it's page 2 or 3 on the full size. Yeah, there we go, under the factors impacting. I mean, we've kind of talked about this. We've had different questions kind of coming and going through this, the whole idea of that the jail numbers are just down. Where does it say, yeah, point number 1, jail population's decreased. Some of this is likely due to the changes for county attorney and county sheriff with, you know, different decisions they made, but not likely enough to reflect the changes. So the question is, because it feels like this is a lot like some of the conversations we have with our FRC. You know, our out-of-home placement numbers are down, all these things are down, and, you know, is it prevention? And so the question I always ask when that comes up is, do we know, or how do we find out, because it was talked about, some of the diversion things we're talking about doing at FRC maybe are impacting here. What do other counties look like? Here's the question. What do other counties, other peers, other jurisdictions look like? Are they experiencing the same thing, or is it something unique? I would just love to find a way to, I know you can't always measure everything. I get that. There's the quantitative and the qualitative, but is there a way that we could somehow get our arms around it so that we know that, yes, these things are working? I do believe also, to say that, Suzanne's not in the room, but when I'm asking the FRC folks that same question, it's like, I do believe that these things are working. I just feel like it would be a stronger position for all of us to be in, like, and potentially even double down in some of those things that because they are working. But right now, we kind of think they might be working. They probably are. Is there? So that's the question. How do we measure up to our peers? How do we measure just ongoing as we're going on this journey? To really know that, yeah, this is working and we're spending $1 or 10 or millions, but golly, we are saving more than we're spending. And so, we're getting transformation in people's lives. People are maybe seeing hope for the first time. And oh, by the way, we might actually be doing it with less taxpayer money.
I think, and I'll have Caleb fill in, he made more details about jail population. I believe most metro counties, the number has been gone down at some degree in the last few years, minus, maybe Hennepin and Ramsey, different, with different trends that have happened where their numbers might be opposite of that. But I would think the other issue is, so it's hard to measure or hard to figure out why something didn't happen. But a lot of these counties already were doing some of the same program we do, so we're kind of doing best practices on treatment court, veterans court, right? But I assume most of the other counties, the bigger metro counties, were already doing that stuff as well, so I think we're in the same box as them on getting some of those services out there, but yeah, it's very hard to predict why something doesn't happen, but I think the data tells that, but I don't know, Caleb, is there any difference on the jails metro-wide of what they're seeing?
Yeah, they're seeing some very similar trends. So we meet monthly with the other jail administrators in the metro and just out on the outskirts of the metro as well. It's been really helpful to be kind of competitive in that group where we're trying to find solutions, and that's great. Yeah, we're seeing very similar trends. I think the data is showing what we want. We have trouble showing correlation. Does the data equal that is because of that work or not? And that is hard to get at.
Well, in that same vein, it's like, okay, are other counties doing greater or lesser degrees of prevention than what we're doing? Is there, because that's what I'm looking for too, is like, what, if we're spending money and time and talent and treasure, is there a payoff? So that's kind of I don't know if there's anyone wants to take a crack at that one. The other question is completely different, scammers, holy cow. I didn't realize I had a bunch of rich uncles, all in Nigeria. I'm trying to get in touch with them. They're definitely getting in touch with me, but I haven't found a crypto machine yet to get that inheritance. But when I do, I'll let you know. But in the meantime, local authorities, what are you gonna do? I mean, this is like an FBI, ATF type of thing, usually, unless if it gets to a bigger number, is that? So we're basically going after the kiosks, or we're not, but nationally, or however that works in the state. Like, why is that not a bigger priority, and who would be the one to really aim at that?
It's really just a game of whack-a-mole, right? Like, we get a few people hit here, somebody else gets a few people hit there. But like I said, they're at the federal level, maybe they could figure out how to restrict some of these communications or track them better or things like that we don't control. But definitely it is just they're gaming on people's willingness to be helpful, willingness to want to win something, and people buy into it. But locally, all we can do is try to do prevention. So like we do probably twice a month, we do a Facebook post trying to educate people. When you get this call, don't return the call, don't believe it, don't bite onto it. But sadly, they don't get a call from somebody who goes, hey, I just got this call, and I'm like, yeah, that was the thing we're talking about on social media 2 days ago. And like, oh, but until you get the phone call, you just don't realize how intense the sales pitch is and the threats that people just get sucked into, and they prey on people that are good behaved folks that are like, oh my gosh, you're gonna come and arrest me? Well, no, if we're gonna come arrest you, we have already done it. We're not gonna call you and tell you we're on our way and, give us Apple gift cards. But they prey on people's willingness to not, and they go, geez, maybe I did miss a jury trial notice. Maybe, the mail, some got lost and I didn't do something. But they prey on that. But so we try to do preventions for social media. And then Kayla ran a program, you can talk about too, with the local PDs and the Bitcoin machines, at least in Scott County. We tried to do some work. Give a little details.
I teamed up with different agencies in Scott County, and we went and posted a warning sign on all kiosks within Scott County. So that was about 6 months ago. All of them are still up. We have our patrol deputies and officers out there looking for them. If a new machine pops up, we post it right away. Along with that, we preventative materials to like the store staff and the clerks, and how do we educate them? So you have someone come in, that's on the phone and frantic and is at the kiosk, how do we alert the clerk to know this isn't real, this isn't someone that's just coming to put money into the kiosk? So we're trying to, be on the forefront and try to figure out how do we stop this before it happens. And like Sheriff Hennon said, like how do we educate these people? And it's not an age range. That was a question earlier. We are seeing victims of all ages, so young kids to older people and everything in between. So it's just like we spoke about how real it is to people. We've had people come into the sheriff's office lobby bawling with the scammer live on the telephone. So, and they direct them to go there, and why, I don't know. But it's very, very real. So we're trying to, be ahead of the ball.
And are we seeing, because I can think of three just sitting here, people that are close or close-ish, that have gotten AI voice, not voicemails, phone calls, with AI generated voice of a relative, and wow, sounds like, are we seeing that? They weren't necessarily in Scott County, but, so you got AI voice generated that sounds exactly like, you know, however they get it off of video or something, who knows what. So it's like, man, do we need a password? Like, so, you know, you get a call that like, okay,
Yeah.
password, passcode, you know, phrase to know like, okay, this is,
You know, and we have gotten those, and the most common one is the grandchild.
yeah,
You know?
that's in 2 cases, that's what this was.
And what we direct people to do is, you know, it's gonna be a race, it's gonna be a rush, right? So if someone's calling you in panic, let's slow down, but get callback information for that person and then call your loved one. Let's verify that they're okay. But you're absolutely right.
Oh.
There isn't one solution to the problem.
There's a solution, but you gotta get close to the problem, but I'll leave it there. Any other questions on this particular topic? Otherwise, thank you so much. It's a lot. It's a lot. It's a juggling act. Thank you so much. All right. With that, we are going to go through our consent agenda. What do we have here? We have, 8 items. Look at that. These will pass in one motion, generally deemed non-controversial. 7.1, adopt resolution number 2025-101, setting the financial assurance in the amount of $180,000 for the SM Henches North Maintenance Facility and the SM Henches and Sons Sandpiper Pit Concrete and Asphalt Recycling Facility licenses. 7.2, adopt resolution number 2025-112, approving a conditional use permit amendment to construct an industrial accessory building over 50% the size of the principal building, Just Moding applicant and KTLM Holdings LLC property owner. 7.3, adopt resolution number 2025-136, authorizing 2 lawful gambling off-site premise permits for Shockoe Valley Amateur Hockey Association in St. Lawrence Township. 7.4, adopt resolution number 2025-138, supporting the City of Elko New Market Corridors of Commerce Readiness Project nomination. 7.5, adopt resolution number 2025-139, authorizing entering into a purchase agreement for and acquisition of real property for the Blakely Bluffs Park Reserve, applying for a grant for acquisition funding, and if approved, entering into a grant agreement with the Metropolitan Council and the budget amendment. And for the record, I am wearing my Buffalo socks, so maybe that's a great spot for them to rotate with the tribe. Just throwing that in there, my editorial. 7.6, adopt resolution number 2025-140, approving the rezone of 18.25 acres from RR to 1C Rural Residential Reserve Cluster District to RR1 Rural Residential Reserve District. Mark Schrader, or Schroeder if you prefer, applicant and property owner. 7.7, approve payroll processing of personnel actions, and 7.8, approved record of disbursements and approved claims. Those are the 8 items on today's consent agenda. Are there any you would like to talk about, pull, or what is your pleasure?
I'll make a motion to approve the consent agenda.
We have a motion.
Second.
We have a second. Is there any further discussion on those 8 items?
I just want to say that I really appreciate our planning commission for taking on the time to look at all these topics and address them before they get to us. So,
well said. Thank you for that. Motion and a second. Any more discussion? Otherwise, all in favor, say aye.
Aye.
Aye. All right, the consent agenda is approved as distributed. All right, moving to item 8.1. We're going to conduct a public hearing at 11. Are we there? We're there. 11:11. Look at that. Conduct a public hearing at 11 or after to receive public comment and potentially adopt resolution number 2025-135, approving the new application for the Ferguson's Minnesota Harvest Orchards LLC combination on sale and off sale intoxicating liquor license located in St. Lawrence Township. Welcome. Good morning.
Good morning, Mr. Chairman and Commissioners. My name is Daniel Sliwa. I am the liquor license coordinator in the customer service department. Today, we are requesting that you conduct a public hearing for the proposed on-off sale combined intoxicating liquor license for Ferguson's Minnesota Harvest Orchards LLC in St. Lawrence Township and adopt resolution 2025-135. All application requirements have been complied with, and St. Lawrence Township, along with myself, recommend approval of the on-sale intoxicating liquor license, and barring any objection, recommend passing of Resolution 2025-135, which allows for the on-off sale combination liquor license for the remainder of 2025. Since the adoption of Resolution 2025-134 on May 6th, which set this public hearing, the emailed notice to the City of Jordan on May 5th, and publication of notice in the Minnesota Star Tribune on May 8th, no comments have been received by myself or the Customer Service Office on the matter. Present in the boardroom today is owner of Ferguson's Minnesota Harvest Orchards LLC, Mr. Andrew Ferguson, should there be any questions for him directly. Thank you. Are there any questions that I may answer?
Members, any questions?
No, but Mr. Chair, I'll move to open the public hearing.
Okay, we have a motion and a second to open the public hearing. Is there any discussion? Otherwise, all in favor?
Aye.
Aye. Public hearing is now open. Anyone like to avail themselves to the podium? I'm not seeing a rush, but I want to wait a second. Anyone? Not seeing anyone?
Motion to close the public hearing?
Second.
We have a motion and a second to close the public hearing. Any discussion? Otherwise, all in favor?
Aye.
Aye, all right.
Mr.
Public comment is closed.
Mr. Chair, I would move to adopt resolution number 2025-135, approving the new application for the Ferguson's Minnesota Harvest Orchards LLC combination on-sale and off-sale intoxicating liquor license located in St. Lawrence Township. And after the second, I'll have a comment.
Okay.
Second.
We have a motion and a second, and now discussion.
Just to the owner, thank you for coming today, Mr. Ferguson. Thanks for continuing to invest in Scott County. I know I had the privilege to talk with one of your employees at Jordan Commercial Club recently about different things you're doing, so it was great to hear, and thank you.
Thank you for having me and for the consideration.
And for the record, I had a kid that was married there. I think at the time you guys were maybe taking over. It was a great wedding. They're still married, so, which is not a surprise.
I never would have guessed. I actually worked there 50 years ago. And a lot of the trees I planted, what's that?
Still hiring.
Nice.
He just pruned my apple tree last week, so
You're
yeah.
welcome. Yeah, I would have never guessed that place was going to become what it was, but anyhow, thank you.
So we have a motion, we have a second. Is there any further discussion? Otherwise, all in favor?
Aye.
Aye, all right. That is approved. Thank you very much. We will now move on to item number 9, committee reports and commissioner updates, and we'll look down to my right. Commissioner Eckman-Bucky.
Thank you, Mr. Chair. Our last board meeting was May 6th. We had a workshop after that board meeting. That evening, I had CAT Finance Committee meeting, the PROACT Board meeting, and the Scott County Foster Care Family Appreciation Picnic. I just want to say a word or two about the PROACT Board meeting. The reason I went, and Leslie and Barb Dahl and others have been working on this issue. Southwest Metro School District has let PROACT know that they need that space. So PROACT has been looking at options for new space in the Shakopee area, and really the board wanted to know, do we still want them here? Does Scott County want them here? Are they important to us? And of course I went and said yes. You know, years ago when we went through that difficult but good transition, things have been great. We need that growth. We need this provider in Scott County. So I said, well, we don't have buckets of money sitting around, but we do support you. We want you there. We want you to be able to grow here. And so they're looking at some options, hopefully to purchase a building that they'd own. And so we'll see. I'll keep you, and I'm sure our staff will keep us apprised of that development. May 7th had quarterly meeting with the mayor and city administrator of New Prague and the county administrator. Then many times over the last 2 weeks, I guess probably it looks like 4 or 5 different days, I have a written report going to Michelle at the Capitol, visiting with legislators, mostly working on the cost shifts, testified at Human Services Policy Committee, things like that. I won't outline all of them. May 9th was scale meeting. May 9th, I had a meeting with Commissioner Brennan. May 10th, had a meeting with Carver County Commissioner Lisa Anderson. She's the newest commissioner over there, and we just talked about some common things. May 12th was the County State Human Services Work Group, the work group where we're really pushing just a placeholder with the cost shifts to give us some time to hopefully see how we can do things differently versus just changing who pays for it. May 12th was also AMC Finance Committee meeting. May 13th, I had my monthly meeting with the county administrator. May 13th was CAP board meeting. I know many people have been asking me about federal cuts and impacts on CAP, and we hear about Head Start often, but for right now, their grants are still in place and Head Start is operating as is. I think the bigger worry right now is the Energy Assistance Program, which serves an awful lot of people in Scott County that are utility providers work with CAP to do that, and that funding is probably much more fragile right now. May 14th was the MICA board meeting. I want to talk a minute about May 15th. Brad Davis and I went up to Hennepin County for what the CEO Next graduation and celebration. We had one participant from Scott County, Tyler Scholl, who went through that program. It's a regional program really led by Hennepin County, but other counties participate. And Tyler owns Bush Brothers Machining in New Prague. He bought it like 4 or 5 years ago and has really grown into a second location. And he talked about how valuable that program was to him as he's been growing and investing. He's actually going to stay involved for another year, just getting mentorship and working with other business owners. So it was really fun to meet Tyler, hear about the growth of his business in Scott County and how this program helped him grow here. May 15th and 16th, I had the AMC Futures Task Force. May 19th, State Mentally Ill and Dangerous Civil Commitment Reform Task Force. And then this morning, Commissioner Brennan and I met with Health and Human Services Director Barb Dahl, and we all had our Scott County Community Health Board meeting. That's the end of my report.
Can I ask a question?
Sure,
based on
please.
the report? And I don't know that it's a question for you or for Leslie, but when we helped PROACT relocate, did we make any financial improvements with the Southwest Metro School District building that were based on that move? And what is the situation with investments we've been made and now them asking to leave? What's the story there?
Yep, I think Leslie can give the amount. We did make some investments, and that's why we're continuing to meet with them about honoring our lease until PROACT's ready. So Leslie can probably speak more to it.
Mr. Chair, Commissioner Ulrich, yes, we originally had a kind of a 10-year lease with them that would have taken us to about 2031. So as the school district was going through some of its strategic planning, and I think some of the growth in the district and some of the mental health needs there, they identified that they needed that space. I think what caught us off guard is that both PROACT and the county learned about it very late in the process and weren't up front. We did invest about $35,000, give or take, in some elevator and bathroom modifications that were needed to meet PROACT's needs at that facility as part of our commitment. I think the school district really took a step back and has been really trying to partner and look at solutions with the county and PROACT, have acknowledged the importance of PROACT, I believe, in our community, and I think are actually trying to even potentially, Barb is still here, but partner and look at, is there even some shared way for a new building, right? And so I think the discussions are ongoing. They've been very positive on giving time and finding the right location. It's been hard for PROACT because most of the space of the size they need is more warehouse, and they really, really like what we have at the Southwest Metro, right? It's more office, it's got windows, it's warm, it's a nice facility. And so to replicate that and try to find that in our community is, I think, what all three of us are working on right now.
All right, thank you.
Thank you. Commissioner Wolf.
Thank you, Mr. Chair. On the 6th, Credit River and Newmarket Township met for their monthly meetings. On the 8th, I-35 Solutions met, and I think last month they talked about 3 bridges being taken down in Burnsville on 35W, and they've begun that work, and there's, it's a lot of traffic there, a lot of barrels and barricades and stuff, and it's funny because I thought those bridges were newer, but they've taken the one on Burnsville Parkway has been taken down. So the one in Elko New Market's going to get a new coat of duct tape. Then on the 12th, the Planning Commission met. On the 13th, Seriously, that bridge is older than me. Anyhow.
Yes. Yep.
Then on the 13th, Prior Lake had their twice monthly meeting, and then the workshop, the firemen and the police are going kind of for a few more folks there. The firemen would like 3 or 4 more full-time firemen, firewomen, to fill out the roster. Things are getting busier there. They have, I think they said 4,000 calls a year. So, and they help with everything, traffic accidents, fires, and so they're busy. And then the police want to hire about 5 or 6 more over the next 3 or 4 years. Elko in the Market had a short meeting on the 14th for a liquor license. Then the MESB met after that. Then I went right to the sheriff's lunch, and that was pretty well attended. Steve Collins was making hamburgers. It was probably one of the best hamburgers I ever had in my life, honestly. And he's got this like 5 or 6 foot little flipper that, I don't know how he does it, but he must have been a chef for 30 or 40 years. And on the 15th was at the Capitol, a few visits there. And then last night, Credit River met, and kind of quiet there, so that's my report.
Thank you very much. Looking to my left, Commissioner Brennan.
Thank you. I'm going to talk fast because my battery is running out. So I'll probably skip a few things. May 6th, I attended the Shakopee City Council meeting. The Shakopee Police provided their annual report to the council and to the community. May 7th was a MELSA finance meeting where we approved the financial report. May 7th was a meeting with Shakopee Fire and Police Chief. We had a good conversation with a list of things that the chiefs were asking about, and Commissioner Beer and I sent that information on to Sheriff Hennon and Leslie Vermillion to look at. And I think those things are coming together with good answers. May 7th was the Parks Advisory Council. May 8th, I attended the Capitol, went down to the Capitol. May 9th was Scale. May 13th, I had a meeting with Patty Freeman. May 13th was a meeting with the Community Development Authority, and they had a conversation about the potential cuts in. Now I forgot the name of it. Never mind. We had a good conversation.
Yes, good.
And I'll get that.
Yes.
Scale Housing Trust Committee had their first meeting that was being chaired by Barb Dahl and Julie Siegert. We had a good conversation about the direction of the Housing Trust Fund and what that committee is going to be doing in the future. May 15th was the Scott County Historical Society annual meeting. May 15th was a meeting with MELSA, and we had a conversation regarding their excessive fund balance of $1.2 million. When we had a talk about how we're going to use those funds, there's some ideas to have it a group project that everybody's working on, and my idea is that we disperse that money into the library systems and have our libraries decide what's the best use of the funds. Last night was the Health and Human Services Resource Council, and we had a presentation on detox in that program, the 2024 financial report, and a legislative update and potential impacts on Scott County. That's all.
Thank you very much. Commissioner Ulrich.
My report is going to be a little light because I was on vacation during much of this period. The 7th, I attended the Foster Care Recognition Picnic, and the 19th, the MVTA Management Committee and Fish Executive Committee later that same day. We're working aggressively on strategies for increasing capacity at posting and meeting needs. That's the end of my report.
Thank you very much. Yeah, please.
It was the CDA meeting. It was the discussion about vouchers, Section 8 vouchers, and a potential of 43% cut.
Thank you for that. May 6th, post-board workshop. Also got a chance to get on the NPR, their air, and have an interview, and was quickly told I not only write in run-ons, but I speak in run-ons, which is it's a truth, it's a fact. But I also realized, I think I found this out yesterday, that our colleague to the south got on KCHEC air. Le Sueur County Commissioner was on KCHEC air. I mean, how did we miss that? Well, there's a special, there might be another session coming, so. And then later that day, foster care picnic. I'm also curious, when I was there, they had the old people call it the DDR, I don't know what it was, that big video trailer, and Molly was, going to town with all the kids out there. Tried to get me to dance. Unless it was the sprinkler, I wasn't gonna, gonna engage. Did anyone engage? Did anyone get out there on the, what I would call the DDR video bandwagon arcade thing?
I did not, but I will say it was very popular because I came at the very end of the picnic and like everything else was done and there were still kids there participating in that, so that was fun.
It was going, yeah. So maybe next year, maybe. On the 7th, as was mentioned, with Commissioner Brennan, went to Shakopee and met with the police chief and the fire chief, and we saw there was a flock, their permit in the right-of-way, put some flock cameras, those have been approved. That was one of the items we talked about, so things are moving. On the 9th scale, 13th, Fish Program Committee also had a labor management meeting that morning into early afternoon. 15th, many of us, once again, going back down to AMC, back to the Capitol and AMC Day on the Hill, and I mean, we have, not just us, but other counties really trying to put a full court press on, please, you have to understand what this means to your constituents and ours. It's the same tax base, same tax pool. And what are we missing? And maybe we can help you understand what we think you might be missing and when some of these things hit the field. So listening, but also educating to make sure everything's, and I think, when the word came back, said, this could have been a text. It's like, no, this is important enough that we need to make sure that we're having these conversations, and we've been down there. Earlier this morning, we had the health board, and I think we were all also at the flag exchange, which was a great opportunity with SMSC. So their flag is now down in the government center, underlit, which looks great. And I'm really still hoping we can get one, I don't see one up here, one in the boardroom, right? We're still working on that. Since we did the exchange, we can get an extra flag and fly one here in the boardroom. So with that completes my report. Looking down to my left, County Administrator update.
Thank you, Mr. Chair. Just quickly, the AUAR with Spring Lake and Township and Prior Lake with the annexation area has begun. And so our staff is partnering Brad and Lisa with the land use and the transportation and accessibility to the shop for sewer and water. So that is underway and looking forward to the outcome of that and some of the supporting roadways that need to be constructed. As part of it, we've had some discussions with the Spring Lake, Prior Lake watershed as well on some work that they want to get done in that area. You approved today the 35 and 2. I think that's the beginning of some planning and work for that interchange. We have been talking about it, but I think that right now is probably the time. They're working hard. I think Lisa's goal is to try to get that into the next update of their 10-year work plan to see if we can get that bridge in there so that that can move forward as well. And then finally, I really want to again thank the facility staff, Troy and Connor and Brian. The Eagle that was placed down there over the weekend, they were in here over the weekend working. They did a beautiful job. That was constructed in 1927 as part of a courthouse upgrade. It was sawed off in 1975 and preserved in some homes across the street. It's been out at the Public Works site. It's been at Marshall Road Transit for 50 years in storage. They had to send it to Wisconsin to saw it in half because it was so heavy we couldn't place it the way it was. And then trying to place them required a lift that could hold that weight. We had a 1/4 inch on each side of the door entries to get that lift in here. And so I think it turned out really, really well, but the planning that Connor had with structural engineers and Troy and Brian to get that taken care of and prepared, just want to commend them on that, and it is safely now hung up. as a piece of the courthouse history. So well done to them and all of their efforts on that. And that is the end of my report.
I was gonna add on, you reminded me of the 35 and 2 with the duct tape comment. Chair Kosnick, I'm trying to think, on the 15th, we had talked about, I don't remember who we had cornered in one of the hallways. You know, obviously, you know, probably not gonna make it in this year, and he's aware of it. And there's the 35 and 50 bridge, which I think probably kicked that one to the curb, but he did make mention that, yes, he's aware of that, and that hopefully in one of these next sessions, we can get that one moved up. And I do just want to talk about the flags just for a second, because, you know, Chair Miller talked about, you know, we're doing the symbolic change. And a lot of it had to do with the work that's been done, you know, by us and certainly by others that came before us, but also the work that needs to continue. So, you know, it was I think a really momentous occasion. Doesn't signify, hey, we're done, we've arrived. It's, okay, now where do we go from here? And they've been great partners and don't see that changing. So it's just a good time this morning. All right, looking down to my right, as it pertains to item number 11, is there any reason we need to meet as it pertains to that, County Attorney?
We do not, Mr. Chair.
All right, so now, the reason I say that is I'm going to move on to item 12.1, to look to adopt resolution number 2025-147, approving conducting a closed meeting as authorized by Minnesota Statute 13D.103 to discuss labor negotiations strategy on May 20th, 2025 at 11 a.m. or thereafter on the agenda as allows in room GCE 231. 231. So we're looking.
So moved.
We got a motion.
Second.
We have a second. Any discussion on that? All right, so we will be in recess to conduct this closed meeting.
Oh, we gotta
Yeah,
vote.
we need to vote. Where'd the Wolfman go? All in favor?
Aye.
Aye.
Recess.
Yes, we're on.
Okay, we are
gotta
back
go.
from a closed session. Moving on to item number 13, adjournment.
Motion to adjourn.
Second.
Motion second, any discussion? All in favor?
Aye.
Aye. We are adjourned.